here for patients. We are committed to giving the best possible care and to continually listen, learn and improve. We want to hear more from our patients about how our care feels for them, what they think works well and where they think we can improve. We are doing everything we can to get their feedback. What has your treatment been like, sir?
Very good. The service was excellent. The doctors were wonderful and the nurses are absolutely fantastic.
What do you think of Derriford Hospital generally, please, sir?
I've always found it very good. I've never had any complaints at all.
And is there anything you think we can improve on?
Well, at the moment I'm still, I can't think of anything that I can think of to criticise, to be honest. I'm very impressed with the hospital and the staff.
I don't remember anything about what happened, but listening to what witnesses have said, I was driving down the road and somebody came round the corner on my side of the road and there was nowhere to go. So, wrote my car off, smashed my leg up, and I don't remember anything at all about it until I was in here. I had to ask where I was. I didn't even know where I was. I've only had to ask, and the nurses have rallied round and either got me what I've asked for or explained to me why I can't have it. But yeah, I haven't been sort of ignored, left or what have you. It's been excellent care.
Is there anything you think we could improve on?
Possibly not. I mean, I've got, if I want a cup of tea, I ask, and it appears. I've had help this morning with showering because I was unable to do it, and that was absolutely fine. My bed gets made whenever I want it done. I felt I felt well looked after and secure, I suppose is a good word to use.
Telling me what ward or department you were in?
It was physiotherapy. The young physiotherapist was very informative, very gentle with me and sort of a bit jokey, which was nice, put me at my ease. I think it's brilliant, you know, no matter what's wrong with you, they've got a department here, haven't they, for it?
And is there anything that you think we could improve upon?
Get the buses more frequent coming here, because I have to wait for a 28.
Yeah, my name's Ian Campbell, and I'm here being treated for leukemia upon Bracken Ward. And as far as I'm concerned, the ward is absolutely fantastic. The actual care is absolutely brilliant. All the staff, the nurses, the doctors, very caring, very positive about your outcome, and really they're brilliant. When I came onto this ward was absolutely brand spanking new. I was one of the first patients on this ward, and I was absolutely impressed because really it's just like being in a hotel, because you've got your own ensuite facility, you've got TV, you've got Xbox. I mean, don't get me wrong, it's not nice being sealed up in a room in isolation, but when you've got these facilities, it makes all the difference. It really does, and it is a big room. And also, window over there, being able to see the blue sky, fantastic. My only quibble, really, about the hospital, it's not really the hospital, is the parking. The parking really needs to be sorted out, because when your wife or your relatives come to visit you, they have to pay extortionate prices. And because it is a private firm, they're making a lot of money out of it. Whereas if it was NHS, NHS could dictate how much it's going to cost and everything, and do a subsidy for anyone who's going to come and visit you.
He had he was born with it all in his ear, and he's had an operation, he's had it packed, and he's also had it cut beyond there, take some skin off his ear to get his ear done and all that.
And how are you feeling, Sean?
Fine.
And has Sean been well looked after?
Yes, he has. I can't say nothing else, they've been brilliant with him.
Is there anything you think the hospital could improve
No, I think they're doing their best here, actually. To tell you the truth, I think they are. They work wonders here.
The past year has seen more change in 12 months in the NHS than in any other period of recent time. Nationally, February saw the publication of the Francis Report. This was followed in April with a significant change to the way the NHS is structured. Locally, the past year has in many ways been defined by a change of leadership in our own trust. Both the Chairman Richard Crompton and Chief Executive Anne James arrived midway through the year, and they have since welcomed a number of new members to the board, including our new Director of Nursing, Greg Dix.
It's just a great place to work, and I've been here for 6 months and I absolutely love working in this hospital. I think the organisation is at an exciting time currently. We want to be the best hospital in the country in terms of the best care we give to patients. We also have a clinical strategy now that will ensure the sustainability of the hospital going forward within the climate that we're currently in, and it's a great place to work.
We have much to be proud of. The Independent Hospital Guide, published by Dr. Foster, shows that we have a mortality ratio that is 10% better than expected, making Plymouth the best in the southwest and among the best hospitals in the country. But we also have work to do. We have reduced events that cause harm to patients, such as pressure sores and falls, but 2012 to 13 did see the Trust report a number of never events. In line with our commitment to openness, these events were discussed and reported publicly in board meetings and were the subject of considerable media coverage. This prompted the Care Quality Commission to undertake their second inspection of our services in April. They visited us at one of the busiest times of the year when the hospital was on black alert, but still they reported that staff were kind, considerate and helpful. However, the inspectors were not satisfied that we were meeting all of our core standards, and in particular that we had done everything to make our theatres as safe as possible. Therefore, they issued us with a warning notice. I am pleased to report that they revisited us in August, and they found the necessary improvements had all been made. As a result, the warning notice was lifted, and the hard work of our staff has been recognised. We have been busy recruiting nurses and have recruited more than 250 nurses and healthcare assistants since January, and yet more have joined us this month in September. We now have more clinical leaders, which means the services patients receive are led by doctors, nurses and health professionals, with managers supporting them. We have developed the Plymouth Way and started to engage more with our staff. We are developing an open culture in which staff and patients feel comfortable in raising concerns, confident that they will be addressed. All the work that is going on, from increasing nurse staffing to theatre changes to getting the number of beds we have right, is all about underpinning safe and good care for our patients, just as we would want for ourselves and our loved ones. This year we have moved our Royal Eye Infirmary from an old Victorian hospital that was no longer fit for purpose to new facilities at Derriford Hospital. These were opened by a royal visitor in April 2013. Last year was about diagnosis of our problems and planning ways to address them. This year we have a new structure and strategy, and we will be measured on delivery. Our challenge is to improve quality whilst dealing with the demands of a shrinking budget. In meeting this challenge, we are resolute in our commitment to spend more time listening to and learning from our patients and staff, and using what they tell us to improve.